Today is your midweek check-in. We hope your week has got off to a great start. Today's subject is really interesting. It's something that he uses a lot in his practice. If you haven't joined us before, we upload 2 videos a week all about integrative medicine topics, and so we'd love it if you subscribed, hit the notification bell so you know when we've uploaded our next video, and as always, give our video a thumbs up. We appreciate it.
Yeah. And so today we're going to be talking about something called SAMe. It's S-adenosyl methionine. It's a naturally occurring substance that we have in our body. And what it does is a methyl donor, so it's involved in regenerating cartilage and in the joints of all of our joints in our body. And I use it for 2 reasons. One, I have in my practice, I practice integrative medicine and pain management, is that I have a lot of patients that have osteoarthritis and they have depression as a result of the pain as well, or they have depression in addition to it. And when you look at SAMe, it's a substance that can actually, it's in our body, you can provide it through supplementation as well. And it's very interesting because most of the studies that have been used with it have been with osteoarthritis. And they found that when they compared it to non-steroidal anti-inflammatory medications, that it worked just as well as some of the more common ones that we use on the market. And the reason that's important is because a lot of patients can't tolerate non-steroidal anti-inflammatory medications or NSAIDs. It gives them stomach upset, it raises their blood pressure, or they're concerned about adverse heart issues that can occur if you already have heart disease. So those people that want to decrease the amount of NSAIDs that they take, or they just don't want to deal with it at all, or they just can't tolerate it, this is a good alternative. Now, in the studies that have been used with the SAMe have been mostly with osteoarthritis, and the second one that I'm going to talk about was with knee osteoarthritis, and they found that they compared it to Celebrex, which is a very common medication that we prescribe for osteoarthritis and pain, and they found that the patients did just as good as the Celebrex patients. Now, they did find, though, there was a major difference, and I find this even in my patients, is when you use SAMe, it takes a while for it to kick in. So if you take like a week's dose, 2 weeks dose, and you're not really noticing anything, go ahead and keep going, because it can take almost up to a month, and they found this even in the studies, that it just takes a while. And this actually occurs in a lot of the recommendations we make in integrative medicine. It's not an immediate effect. The other beneficial aspect of SAMe is that it has been shown to help with depression. And the way it works, they think, is it increases dopamine and serotonin in our brains, and so it counters the depressive effects of those having low levels. And the nice thing about it is it can be used in conjunction with other antidepressants that you're taking. So this is a perfect example where you can use the integrative aspect plus the conventional medicine approach with traditional antidepressants to help decrease the dose of antidepressants that you're taking, or actually substitute it if you find that SAMe by itself is doing the job.
Well, and oftentimes when you have chronic pain, you have depression with it.
Right.
It is one of the risk factors for depression.
Yeah, and now it's very well tolerated, and sometimes you have to go to almost 1,200 milligrams a day of the medication. And when I prescribe it, I usually start at 200 milligrams twice a day and slowly start titrating it up. There have been reported side effects to it, however. Some people get insomnia. There's been some stomach upset with it. Some people get what they call somewhat even depressed a little bit before it starts to kick in and start working. But overall, it's a very safe supplement to take. And if you find that you're interested in it, talk to your doctor about it just to see if you'd be a good candidate for it. Not everybody is a candidate for it. People that have bipolar disorder are probably not a good candidate for it. And again, I've used it in conjunction both with the non-steroidal anti-inflammatories and in people who have already been started on antidepressants, as both to help with their arthritis pain and to address their depression at the same time. So if you're looking for an alternative, or you find that you're having side effects with a lot of these medications, you may want to consider mentioning this to your physician.
Does it help with all kinds of arthritis, juvenile arthritis, rheumatoid arthritis, or just the osteoarthritis?
The studies that I've been able to find have been mostly with osteoarthritis.
I see. Well, that's it for today, and we can't wait to see you again next Sunday with another episode of J&J House Call. Thanks you guys for subscribing. We appreciate each and every one of you. Comment below what you'd like to hear about. Next Sunday is going to be about brain fog.
Yep. Have a nice day. So long.